So welcome everyone. My name is Kara Kaikini. I use the she, her, hers pronouns and am the executive director of the Maine State Breastfeeding Coalition. Before we get started officially with the webinar, I wanted to make a few announcements. This webinar is being recorded and it is available, it will be available on our YouTube page. We aim to have the captions on these recordings. They're not always accurate right away, but we do have lovely volunteers who will review our webinars and clean up those captions as we go. Also, we don't have CEUs for this webinar right now, but we will send you a certificate of attendance if you fill out our evaluation form. And then at the bottom, it asks you if you'd like us to send you a certificate of attendance. We'd be happy to do that. So please fill out the evaluation form either way and let us know about your experience with the webinar. And I want to thank you again for attending and thank you for taking that extra step of making a donation of any size so that you could be here today live. We are a small nonprofit who operates on the generosity of our donors and sponsors. And so we want to thank you for supporting our work and for making it possible to do this. We are also in our end of year fundraising campaign right now and would really love any extra donations that you're willing to make or at least sharing with your own networks about our organization and about this end of year giving campaign. And now I would like to introduce our speaker. Brianna is a certified prevention specialist in the substance use prevention program at Bangor Public Health in Bangor, Maine. She has been in this role for 9 years and has worked in prevention for 16 years. Brianna shares that at Bangor Public Health, we know that while not all substance misuse can be prevented, our work targeting risk factors and strengthening protective factors with individuals and family and peer relationships throughout communities can have a big impact. Brianna is also the parent of 2 amazing teenagers who, while they both were breastfed, are still more than happy to survive on chicken nuggets and chaos. I love that. Same here. Same here. All right, so I will turn it over to you, Brianna, if you want to go ahead and share your screen.
Wonderful. Thank you so much. I'll get that pulled right up here. All right, so it looks like you can see my screen up here. Thank you so much for having me. I actually do have 2 teenagers, and my oldest turns 18 today, which is like this whole new realm of excitement. And oh my goodness, I have a whole grown-up in my house, so that's super, super fun. So thank you for having me today. This whole project came about a number of years ago, specifically within Healthy Androscoggin, and they were having some concerns about the increasing rates of cannabis use among those who are pregnant or breastfeeding. So they applied for some innovation funding, and they just did some evaluation to see what the landscape around cannabis use while pregnant or breastfeeding was looking like. It was done with online surveys, and it was looking at those attitudes, beliefs around it. So when we talk today, we're going to be having this conversation about the current science, about the risks of use during pregnancy and lactation, those short-term and potential long-term effects on both, that infant and the parent. Will share some of the terminology, what these all mean. But really, I want to have time to share with you some skills and tools to have this conversation with the people that you're working with in a non-judgmental way. Please feel free to ask questions in the chat, and we will take time at the end of this. And if I don't have the answer, I will get it to you as soon as possible. So it's an education session, and I want to make sure that you leave here with what you were hoping to get. And across the board, a continuing theme with this is we don't want to vilify those that use or choose to use because among all of it, we know that parents and caregivers really are truly doing what they think is best for themselves, for their own health, and for the health of the young people in their lives. And when we look at the themes that have been happened with these participants, they are describing things that really are showing the reason why. Why are they choosing to use? What are the benefits that they are getting? And just looking at what are some of those continued use for their own health management? Is there an ongoing evaluation process? We have a lot of mixed messaging. We don't have a ton of research. We have a lot of folks from those who use cannabis to those who are in the care setting, they wanting more information. And across all of this, again, we still have those legal concerns. So really just acknowledging all of that as we go through this, not vilifying those folks, and coming from a place of learning and understanding, and the fact that everybody really wants what's best for themselves and also the young people or the babies that they are caring for. Quickly, just looking at some past 30-day use. So that's like that current use. And this was done with a recent young adult survey that was administered by the Maine CDC. We looked at those 18 to 25-year-olds. Those are our adults, our emerging adults, our young adults. And what we were finding is that 34% of our 18 to 25-year-olds are using cannabis within the last 30 days. That's that current use. Looking at this, 18 to 25 is we have a lot of folks that are getting pregnant during those time frames. So we wanted to really acknowledge what that looks like across the population. As far as those that are pregnant here in the state of Maine, what we found is that about 11% used cannabis at some point within their most recent pregnancy. And among those people that are choosing to use cannabis, they are looking at those messages of natural wellness, healthy ways to manage health conditions, anxiety, sleep, all of those sort of things. So about 24.6% used in a month prior to learning that they were pregnant. 17% have used cannabis since that baby was born, or 30.4% had cannabis use within 12 months or that 1 year before the pregnancy. And this is something we ask questions. It has been a very long time since I was pregnant, but as a care provider, we're asking a lot of questions and giving guidance and suggestions about a lot of things that can cause problems within a pregnancy. And really starting to have the conversation in a way that is not judgmental and is from a caring safety aspect is really important. So it's just thinking about listeria from lunch meat, although I might need to increase that. I need to check that number again because I think we've had some safety outbreaks with that. These are just some of the things that we have been talked to about when we are pregnant. So really adding cannabis into that conversation, really getting at that safety aspect. So the science, some of the fun little bits and pieces of cannabis and understanding how it works, what it's doing. The first component really is THC. There are two cannabinoids from cannabis that we hear mostly about. There is the CBD, which is something that doesn't typically cause psychoactive reactions, and it is more legal and less regulated across the board. As far as THC, that is that delta-9 tetrahydrocannabinol. That is that psychoactive component of cannabis. It is what causes the feelings in the brain. It does cause changes in the brain function, so how the brain is working during the use, and it can be consumed or used in a variety of different ways. It can be consumed in food and drink, so your edibles. It can be done by a combustible smoking or vaping or dabbing. We'll explore, and I'll show you some examples of all of those. There are more than 50 cannabinoids in a cannabis plant, which is a lot, and they all have a very big variety of what they do and how they do things and how they make people feel. So if you hear folks that you're working with are like, oh, I use this strain, or I have this strength, or this hybrid. It's because they do different things, different components. And those cannabinoids are those natural occurring chemicals. So it's not typically something that it's being manufactured in, it's the naturally occurring. And they cause those effects on the body, including the central nervous system and the immune system. Some of those potential health effects. So there's a reason why people are using cannabis, and sometimes it's for what they believe are the potential health effects. Sometimes it's for that feeling of it. So somebody who is consuming marijuana in a variety of different ways will have short-term effects, and some longer-term health effects, and some have more harms than others. We also know that, especially with adolescent use, before the brain is fully developed, may impact changes to the brain development and increase the risk possibly of addiction. So some of those short-term effects that somebody might experience is a sense of euphoria, just a different feeling and different way that they're existing in time and space. They might have some enhanced sensory experiences. So looks, sight, smells, touch, all of these things might be enhanced or changed in some way. There might be that drowsiness or relaxation. They might experience something around like a decreased reaction time, so it takes them longer to react to things. It may impair their balance or coordination. So if you think about somebody who is pregnant, their center of gravity is changing. You using a substance that changes your equilibrium could be some long-term or some shorter-term effects that are more acute and not as safe. There's also a potential for an increase in heart rate, blood pressure, increase in appetite, which is one of those things where it's increasing appetite potentially and being like dealing with your nausea. And so that might be somebody who is experiencing morning sickness. They might be thinking, oh, I might be able to take care of my nutrition needs by using cannabis because it's going to help my appetite. It's going to make me feel better. Then there's some of those more negative effects or impacts. So the negative impact on learning, concentration, memory. Some folks might experience some my goodness, I can't say that. Paranoia, that was a mouthful. My goodness. They might have some poor concentration, poor problem solving. Long term, we might be looking at a chronic cough and lung and respiratory issues, loss of motivation. There is something that is coming out with some of our folks that have been using for a longer time, and sometimes with the potency of the amount that they're using, they might be experiencing something called cannabinoid hyperemesis syndrome, which is kind of what it sounds like. So somebody who is using cannabis is having nausea, vomiting, feeling really, really awful, not able to get nutrition into their body, and causing problems that way. There's a variety of different ways that that is treated, but that might be something that somebody may experience. Just a quick check because I have you all on a different screen. Are we good for pace? Is this okay?
You're doing
Nobody?
great, Brianna.
Okay, awesome. Thank
Thanks.
you. Sometimes I get talking a little fast. I want to make sure, really respectful of that. So looking at some of the risks of use. So when I was in high school, cannabis was very, very different. So the cannabis of 30 years ago, very different than the cannabis of today. We are widely recognizing that it is a lot more potent. The potency or the strength has consistently increased with those THC levels rising from, like 4% in the mid to late 90s, anywhere upwards of 17, 18, depending on the product, it could be even higher. So a lot of the evidence that we have about the risks and adverse outcomes when it comes to cannabis comes from older studies and older research that is done on less potent or less strong forms of cannabis. So the American College of Obstetrics and Gynecologists, they have found that there are multiple negative effects possible for a person who is pregnant who does use cannabis. It can be that permanent lung injury, dizziness, impaired judgment, lower oxygen levels within your body. And those people who frequently use or regularly use cannabis might experience some low birth weight babies, some preterm delivery, compared to those people who are pregnant who don't use cannabis during their pregnancy. And many of them who do choose to use are doing so because they're believing that it is relatively safe and they're not getting the messaging stating otherwise. Studies have cited other factors too, including there's a lot of uncertainty, there's a lot of unknown, a lot of questions that still need to be answered about adverse perinatal consequences. We have a lot of perceived therapeutic effects of cannabis. There is sometimes for our folks a lack of communication or counseling through their healthcare providers that is contributing to that perceived level of safety among people who are pregnant. And then we have a lot of messaging from the industry itself about really dealing with the fact that sometimes when you're pregnant, you don't feel good. And this is a huge issue for a lot of pregnant people and one that doesn't have a lot of remedies. There's not a lot out there that can help some people. And you're told, oh, you just got to ride it out. You just got to tough it out. And you know what? That's really, really hard. I know there's some new research out there that has maybe found the key reason why some people have morning sickness. But really, there's not a lot of support or information out there. But as a pregnant person, you're scrolling through your favorite online pregnancy support program or parenting site, and you're seeing ads for some things. Looking for the good stuff. Moms everywhere are discovering. Thinking about how we are normalizing and kind of medicalizing the cannabis industry to look like this. It's really appealing for somebody who feels awful and cannot function in their normal everyday life. If they already have children at home, how are they able to parent them? If they're trying to work, if they're just trying to feel okay within their pregnancy, this can be really hard and it can look really appealing for somebody who is suffering from that morning sickness. Nobody is saying, wait a minute, no, you shouldn't do this, because there might be problems associated with it. So we really want to have the conversation and get some information about, have you tried other things? What are you experiencing if you're using cannabis? How is it helping you? Is it causing problems when you're not using? And sometimes what we're finding is the retail industry with cannabis may be promoting it and promoting that use as something that is safe. And we know there was some studies and some evaluation environmental scans done in Colorado where 69% of the retailers talked to, so they went in and they talked to retailers, 69% of them were recommending this for morning sickness. They were recommending cannabis use in a variety of different forms. 31% of those retailers stated that it was safe to use during pregnancy, and only 3% were deferring to a clinician. So there is a trust in the cannabis retailer, in the cannabis industry, and product safety. And there is a really big, diverse selection and staff that is seen as knowledgeable, caring, and non-judgmental. So what we're trying to counter here is like, let's wait, let's think about this, let's look at other options, let's really examine what are some of the potential outcomes, good and bad, of introducing a substance, a psychoactive substance, to somebody's body who is creating another body. Some people are self-medicating with cannabis. We don't have any evidence as of yet within the research of cannabis that it is helping manage. I know there is a lot of anecdotal evidence, but we really want to make sure that we can back this up with the science. There's lots of things that folks can try. So working with your clients or patients about what else they could do. I really wish there was some better answer because this can be really debilitating for a lot of folks. Although it's been really kind of given to us this information a lot about tobacco secondhand smoke being harmful. There's a little bit of a perception that, cannabis smoking is less harmful to the health, it's less addictive, it's more socially acceptable than than tobacco use. Cannabis and tobacco smoke, so when you're using combustible cannabis, so you're lighting it on fire so that it is smoking, have many of the same toxic chemicals. So breathing in any type of a smoke can be really harmful for both yourself and your baby. And you also want to make sure, besides just what you're doing yourself, the folks that are in your house or around your kids are also taking precautions for this. So again, believing the relative safety is sometimes putting us in a position where we're doing things that we have a perception of safety, but the evidence and the science behind it isn't backing that up. And then again, I love the brain. This is probably one of my most favorite parts of what I get to do is looking at the brain and brain development from in utero all the way up through to adulthood. So the brain is still developing until about the age of 25. It has two major time frames of growth, and adolescence is one of that. So that puberty to 25, just lots of stuff going on in there. So THC, where it is that psychoactive component, it does contribute to changes in the brain. We know that cannabis use does interfere with memory, attention, and learning. It will interfere with short-term memory development, and you cannot have learning and long-term memory if you don't initially have that short-term memory. It can also cause problems. THC can cause problems with REM sleep and that really restorative sleep. And looking at some of those key neural pathways for motivation can be disrupted. Beyond learning and attention, we also need to address the fact that cannabis can affect people's mental health. Initially, cannabis or THC will calm and relax a brain. Cannabis THC is incredibly strong. It binds 4 times stronger to the receptors in the brain that we all have than it does to our naturally occurring brain chemicals. So if we introduce a chemical into our brain that's not naturally found there, you have one that is 4 times stronger. So it's going to hit that much harder. Eventually, if you continue to add this chemical to a brain, that brain, because sometimes it likes to do the easy way out, it's going to be like, nah, I don't like this natural one. I want to have the one that makes me feel really good really fast, the one that is stronger. And eventually you can't relax without it. So, one hand, science and research, we are finding that folks that are using cannabis, specifically teens right now, are 2 times more likely to experience heightened depression and anxiety symptoms. On the other hand, young people, young adults might be using cannabis to cope with those conditions, to self-medicate. The key here is the brain wants to do what is easiest. The brain's natural ability to calm itself will decrease as cannabis and THC takes over. Now looking at the effects on both an in utero baby and a postnatal baby. As that baby is development, the THC enters into the fetal brain and it does disrupt the endocannabinoid system. So this plays that important role in learning, memory, anxiety, depression, addiction, appetite, feeding behaviors, pain, and what is called neuroprotection. So you have a disruption in brain development even prior to birth. These babies tend to be smaller in size at birth, so you get little squishy ones. There is a higher risk of stillbirth, a higher chance of being born too early, especially if we have co-occurring use for a pregnant person who uses both cannabis and tobacco cigarettes during their pregnancy. There is the harm that can come from secondhand cannabis smoke. So maybe the pregnant person isn't using, but they're in a home or a vehicle with somebody who is. And what they're finding is further on down the line, because of that brain development disruption, that there are other problems with that child as they get older or school age. In some studies, we are seeing an increased aggressive behavior, attention deficits, all of that sort of thing. So really thinking about when we have intervention on the adult side, it will contribute to prevention on the youth side. Intervention will turn into prevention. Now going beyond the pregnancy to lactation, the kicker with all of this is very little is known about cannabis use in breastfeeding. One study suggests that, moderate amounts of THC does find their way into breast milk when a nursing parent uses cannabis. Some evidence shows that exposure to that THC in breast milk in the first month of life can result in decreased motor development at about 1 year of age. There is not enough data to evaluate the effects of cannabis use on infants during lactation. And because of the absence of that data, because we just don't have it yet, I'm really thinking about asking and having the conversation, why are you as a like in a non-judgmental way, what benefits are you gaining from using cannabis? Is there something else that you can try to do instead? How much are you using? How often are you using? Having those and really encouraging cutting back or discontinuing use just until we know. We really feel strongly that people, especially breastfeeding or lactating people, need to be informed about the potential risks of exposure and be encouraged to make what is as healthy and safe of a choice for you and for that person. With regular use, essentially what happens is the THC in somebody's body will accumulate in high concentrations of where there's a lot of like fat. And if you think about the fatty acids and you think about the brain and you think about breast milk, that is where the THC is going to hang out and it's going to stay. Breast milk is amazing. It is such an asset for that infant, but it's going to go through their whole body. So if you have an accumulation of THC that is traveling through the breast milk, now it is in that baby. So babies are made, their brain and their whole bodies have a lot of body fat also. So it's going to start accumulating in there. So this is something different than alcohol use with somebody who is lactating, where with alcohol, it's metabolized through the liver and then it is flushed out through the kidneys and that whole system. So it doesn't stick around. Alcohol doesn't stick around. So you can pump and dump. So if you know that you're going to be consuming alcohol, you can pump the milk. The amount of alcohol that is transferred through breast milk is not super well researched. I don't think it's a lot. With cannabis and specifically with that THC, it sticks around in that body fat and in the milk fat. So pumping and dumping is not going to work the same. So monitoring this and thinking about it and thinking about how much a person is using, how often, and the strength really important. Because safety and health is at the top priority when it comes to the adults that we're working with as well as the infants. So we want to make sure that if you have person that you are working with who has an infant and they are consuming cannabis, that they're taking some extra safeguards. So beyond just thinking about their use in relation to lactation, thinking about use in relation to caring for and being within a home of an infant. So we know that being impaired or being under the effects of THC while caring for an infant or a baby or a child is not safe. Also, not just that birthing parent, but also other caregivers for that child. Some cannabis or THC can make people feel really sleepy, and that's why they use it. Co-sleeping, not sleeping with your baby if you're under the influence, if you're using a cannabis, really important to think about safe sleep practices around that. If you do plan on, as a caregiving parent, to use cannabis, making sure that there's another person that can safely care for your child, like an adult or an older teen that can take care of while you are using that cannabis. Again, not judging, but how can you keep this environment of safety? We know it is not safe to drive a car while impaired by cannabis, also not letting yourself or your infant ride in a car if that operator is affected by cannabis. Um, this is also the same for certain cold medicines. We want to make sure, like, if the warning label says, like, don't operate heavy machinery, that's not just talking about like a forklift or a log truck. That also means like a vehicle. So knowing your body, knowing how you can take care of it, sometimes just over-the-counter cold medicine can cause problems too. And all cannabis products need to have, so this actual little last part might be changing here in the state of Maine because we had some new legislation. So as of right now, all cannabis products need to have universal symboling on the packaging and edible product. So it's a triangle and it's green and it has like the cannabis plant outline. That has been required by state law. There is legislation that is coming through that is changing that requirement. So stay tuned for that because we might be losing the labeling requirement and packaging requirement. So really important though to teach your kids, especially when they start getting mobile and they're exploring their world by putting everything in their mouth, not to eat or drink anything with that symbol, keeping it safe and stored away. This goes for any little ones that you have in your house, any not so little ones you have in your house, furry friends, four-legged friends. Really important to keep this stuff safe if you are going to have it in your home. Quickly looking at just some accidental exposures and cannabis poisoning control calls. So the Maine's adult use law was voted in 2016. Sales started in October of 2020. So there has been an increase in accidental exposures for little ones to the Poison Control Center of Northern New England. So what does it look like if my child eats or drinks something that has THC or cannabis by accident? Cannabis, THC in children, because they're little dudes, they're little, can make them really, really sick. They might have problems with walking, with balance, or sitting up. They may start to be really, really sleepy or having a hard time breathing. They might be presenting with an altered mental status. This can range from extra fussiness to lethargy to being really agitated. Some seizure activity has been reported, and it's something called ataxia. So ataxia will mimic that sign and symptom of somebody being drunk. So slurred speech, stumbling, falling, not being coordinated. So if you are worried, so as somebody who is an adult that is working with other adults that might be consuming cannabis, have cannabis products in their home, and they have little ones, really encouraging not just safe storage, but if you are worried, if you think that your child has consumed a product, calling poison control as soon as possible. The call is free. You'll be helped quickly. They are wonderful there. If the symptoms seem really bad, calling 911 or going to the emergency department right away is incredibly crucial. So we want to just make sure that people have the skills, have the tools needed, that if you are going to have cannabis in your home, preparing for the what if. Hopefully we don't have the what if happen, but we want to make sure that we have the knowledge that we need to do something effective if the what if happens. How is cannabis overdose in children treated? If your child accidentally induces THC or cannabis, sometimes you just kind of have to wait it out. You might have to do some like IV to help with any dehydration if there's a lot of nausea and vomiting. Sometimes it's just a wait and see approach. We like to encourage safe storage, and we do safe storage in a lot of different ways. It is a really big part of the work that we do. So if you have somebody you're working with and they have cannabis in their home, making sure they're taking the precautions to ensure that safety, keeping it up and away, out of sight from curious children. There's a lot of product out there that looks very similar to products that kids really like. Gummies, sodas, some of those enticing treats that kids are like, ooh, I'm not supposed to have that, but I really like it and I really want to try it. So we want to make sure if you are using cannabis, especially those consumable pieces, you're keeping them safely stored away from curious kids, picking that place where kids cannot reach. And this really should go for any type of vitamin, medicine, anything like that, that can be causing harm if it's used in an inappropriate way. Even medicine that you use without a prescription or with a prescription, you want to make sure that you're kind of exploring your world as your young people do. See what you can find at their eye level, see where you can put it that isn't. Really important if you are traveling away from your home or having somebody come to your home that they are practicing these skills as well. If you are using cannabis as that adult, that you are putting it away every single time. We're not leaving it out on a kitchen counter or on the bedside. Even if you're going to use it again in a few hours, making it safe and secure every time, really important. If you can, consider purchasing a locking bag or box, or if you don't want to purchase them, we do have some available here at our office. I know our public health nurses have used them before, and we like to supply them with that. It's that safe, it's convenient, it's affordable for securing cannabis products within homes. And talking to the kids in an age appropriate way, just like you do with any other medications or vitamins or safety habits, seatbelts, bike helmets, gun safety. We want to make sure that we are having the conversations with kids so that it's not something that's a surprise, and their brains like to explore and try things out and experiment to see what happens when things are around or they see something in front of them. So we want to give them the information so safely they can explore their world, and not encounter problems. And again, with your guests, making sure they're adhering to these also. As your kids get older, really important to think about the other adults in their life and having the conversation with other parents. So if your child is spending a lot of time with other parents or other caregivers or other adults, really communicating with them as adults about these are the expectations that we have for a young person. This is what we do in our home. What do you do in your home so I can understand your expectations and reality, and I can adjust how I am a parent when it comes to that sort of thing. So cannabis terms to know. All of these products here are products that you can get right here in Maine. They might look familiar. They might be like, oh my goodness, what is that? There is not a lot known about any risks or adverse effects for the different modes of delivery of cannabis or THC during prenatal use. While we know combustible or smoking is the most common, the availability and the variety of those edible or consumable products are increasing that as a preferred mode of use. We don't know the risks between all of them. Could one be worse than the other? We don't know. We're not sure. So what we're finding is those that are choosing to use cannabis, they tend to prefer modes that they think are safe or convenient or effective. So our vaping products might be seen as more of that. Edible products. So you have some candy there, you have some cake batter, you have some different pill form things, you have a little drink, you have a topical. They all have various dosage, various strains, and they are used for different reasons or different effects, and they can affect consumers differently. A really high potency product, if you look on the right hand side of your screen, those are what they call dab or honey oil. That is a highly concentrated form of cannabis THC that is done with various extraction techniques. So those can be upwards of 70, 80, 85% THC. That is an incredibly strong product, and there are different modes of delivery for that. So that's what that is. It's not as familiar, but it is available. And again, looking at that potency, this is the amount of THC that is in any of the given products as a percentage. And potency can differ drastically between product types. Anything over 12% can be considered high potency with your typical products. Concentrates can be 40 to 80%. If we're looking at frequent cannabis use as well as using those high potency cannabis products can increase the risk of a cannabis use disorder. We're also looking at what are the standard units and servings of cannabis. Typically, it's like a 10 milligram product of like a 7 or 8%. There's just a lot of confusions and a lot of numbers, and not all studies are studying the same thing. So we just want to make sure, understanding there is a higher potency, there is stronger cannabis out there, and the way that they are using it is really important to understand, asking them that question, why, how do they feel during, how do they feel after, and the longer you use that higher concentration, the more likely it is the risk that you are increasing for developing a use disorder. Really important to get that across. We have a lot of access and availability here in the state of Maine. This is the Canna maps, Canna menus. So at the point of this screenshot, there were 451 locations that you could get cannabis here in the state of Maine. I think that has changed. And sometimes your algorithm in your social media will just really start being an algorithm. So this is actually a screenshot that I took earlier this week. And it was gummies crafted for a good time. And it's very small, where you see that there is a cannabis plant, but the words around that symbol says that it's 100% vegan. If you look at this, you're like, oh, those aren't, what do you mean those are cannabis? Those are THC. Where does it say that? Good question. It really doesn't. But if you know some of the words to look for, you might be able to kind of decipher or translate that information. If you have something called gardening, that is a new social media term when it comes to using cannabis products. If you go to this Botany Farms website, it is a really nice website. It looks great. It's not like what we typically think of as a head shop of here, get your weed, here, get your pot here. It's a really classy, really kind of tapping into those wellness, vegan, no artificial, just that availability, the access to it, and the perceptions around it. So having these conversation tools, I'm just checking time real quick. What was started with this Healthy Androstrogen project was asking social service providers some of the questions of how do you talk about this? What do you say if somebody asks you the question? So it really started us with thinking about how can we explore this more? How can we inform more people? How can we give our providers the tools that they need for this while giving the most accurate, safest information for the folks that are experiencing a lot of different life? They might be pregnant, they might be parenting, they might be lactating. How can we be supportive of all of that so that everybody, because again, everybody wants to do what is best, safest, and they're doing this out of love. So we want to make sure that we are supporting them as much as we can with information. So this is really a motivational interviewing technique. And for those that are not familiar with motivational interviewing, I have a feeling we have a lot of social service providers on here. You're familiar with this. A quick rundown. Motivational interviewing is a way of being with a person. It's not just a set of techniques for doing counseling or having a consult with somebody. It is where you become a partner as a helper in the change process, and you are at every point accepting you're expressing and communicating acceptance of that client, of that person that you're working with. It's not just a way of interacting with people who use substances, but motivational interviewing is something that is used in a variety of different ways. And it also is really just encouraging and helping those folks that you're working with realize their personal goals for whatever that reason is and meeting them where they're at. So there was a really great webinar that we just did from Kelly Young Wolf, who has a Master of Public Health at a Kaiser Permanente in California. And she really broke down having these conversations and how to discuss it in a motivational interviewing way with just some key points about what to do, those recommendations. So the first one is ask and be curious. So as that provider working with the person, working with your client, learn and practice how to bring the cannabis use up. Maybe you start scripting for yourself. Maybe you practice with a colleague. Maybe if you have any neurodivergence in your life, you might hear scripting or social stories. Using those skills to develop skills on how to ask and be curious in a way that is not judgmental. There's always that confidentiality piece. It is open without judgment. The second part is making sure you're listening. People that you're working with, pregnant people, parenting, they want to explain, these are the benefits that I'm getting from using cannabis. This is what I'm experiencing. And this is something that I prefer over the risks of using a prescription for various things. So being open to listening and accepting what they're telling you, not, oh, you don't know, pharmaceuticals, really being accepting and listening to learn, not just to rebut what they're saying. And that kind of feeds into having a dialogue. It is engaging in a two-way conversation, asking questions, listening to the answers, and not just lecturing. Will open up that person. They're going to see, oh, we're partners in this. We both want what's best. You are supportive in the way that I'm doing it. I trust that I can come to you and I'm not going to be judged and I can ask the hard questions. And it might be scary, but I know that you have my back. You're going to help your person feel more comfortable and open to having the discussion, because we know it's really hard to have this with somebody that you think has power over you, is going to judge you, and you don't feel safe opening up. We want to acknowledge and appreciate that whatever choice that person is making, they are doing so because they truly believe that it is the best choice for themselves and their baby. I can't think of a time where somebody's like, well, screw you, I'm gonna do whatever I want and I don't care what happens. They are doing it out of love. They are doing it because they care. They are really doing it out of those good things, not for bad reasons. We want to try to provide as much information, health information, education, benefits, risks, so that they can make that informed decision with all of the parts and pieces. And if you're at a place with this person that you're working with, support, praise. I'm really proud of you. I'm really proud that you only used 5 times instead of 7 this past time frame. Help them feel good, help them feel supported, help build their confidence, because if you can start building that, they might realize that they don't need to use to deal with their anxiety about becoming a parent. They might feel more confident and supported about being a parent, and they don't need to use a substance to feel better about it. And then really quickly looking at just some additional thoughts through that social equity lens. And we really want to make sure that we're not using this data or information in a way that feels penalizing or looking at punitive punishment. So there's a lot of fear associated with disclosing that as a pregnant person or as a lactating parent, I am using something. And there's a lot of good reason why they have a lot of fear. Participants in some studies have reported that they don't disclose cannabis use to their healthcare providers because of their stigma. There is fear legal repercussions, child protective services. They might feel, you know what, I'm really private. There's so much negative stigma about this. I don't want that. I might have other children in my home. I don't want them to be at risk. I don't want to be at risk for losing them. Just because it's legal doesn't mean that we're not going to be stigmatized as a pregnant person for using. So I'm just not going to bring it up. Really thinking about that as you're having these conversations, as you're developing policy within your own organizations about substance use beyond just cannabis use and those folks that are within your care. These are just some quick examples of some of the resources that we use. We do work with our retailers here in Penobscot County. We give this information out. We have locking bags. We have great information from the state and from the Office of Cannabis Policy and the CDC. Really helpful. I will say that the retailers that we have worked with are wonderful. They love getting this information. They really, truly do want what is best for their customers. And we've had great success and great conversations with a lot of our retailers here in our area. Some other resources for you to share, and I'll make sure I share this with the organizers so they can send this information out. Good to Know Maine, Let's Talk Cannabis Maine, Let's Talk Cannabis Maine parents. If you have older kids, great information about how to have conversations. I'm sure many of you are familiar with the Snuggle Me project. Great place to get information and data about use across the board with a lot of different things is that maineseow.com. Love getting data from them. It's really awesome. And it's as up to date as it possibly can be. But again, thank you. Really reiterating the fact of adult intervention and having these conversations with adults will lead to more youth prevention. The conversations might be intimidating and we don't know everything at this point, and it's okay to acknowledge that. We're all human and we're in a unique position to counsel our participants, our clients about the potential negative effects of cannabis during lactation or pregnancy. They may not be getting this information anywhere else. Legalization has certainly changed a lot of things and changed the landscape and given the false impression perhaps that cannabis use across the board is safe. There's a lot of health messaging coming from not so reliable sources, like the ones that are selling the actual product. They have monetary gain. But being willing to talk about this is really important. And we know from the data that folks want to be able to trust their care providers if they have questions. And we really want to look at how do we promote those best health outcomes for parents and for babies. Parents really, you know, they deserve to know the potential implications of use so they can understand their risk. And if we choose to remain silent, sometimes that silence sends a really big message that maybe it's okay because my provider's not bringing it up. They're not having a conversation, so it must be okay. So yeah, these are my little ones from little to not so little. And yes, they were breastfed and now they have chicken nuggets and it's just chaos at my house. So thank you. I will stop sharing my screen so that I can bring you all over here and open it up for questions. And like I said, if I don't have the answer now, I love to get that information out.
Awesome. Thank you so much, Brianna. That was really, really great. Really helpful info. And I'm going to open it up. We're seeing thank yous and fantastic in the comments here. What questions do folks have? While folks are thinking or considering typing in the question, or if you want to raise your hand, use the raise hand function, or just type in the chat that you want to unmute if that's easier, we can make that happen too. I really appreciated so much of that, especially the conversations, the conversation tools that can be helpful in so many different areas on so many different topics. I really appreciate how you are kind of validating that people are choosing to use these substances not just as a big screw you, like I think you were saying. But because they have reasons, right? And the more we can understand that and listen to that, I think the more they can start to trust us in offering them better support and education around it. So really appreciate that. Um, I'm curious from you or from other folks, um, if what kind of guidance you're giving parents who are wanting to use it for morning sickness, what other options are you offering for that, but also for general anxiety or any of the reasons that you're hearing? What are some alternatives that you're offering? So, asking you, Brianna, but also anyone who's on the call, what would you suggest could be offered as alternatives if that's what if it's appropriate to be sharing those with them?
As far as me, I am not a clinician or a clinical provider or anything like that. So, and I honestly, I don't do direct service. Um, but I know within doing this research, there are other modalities for treating that nausea. Um, so I think also that anxiety, what is the anxiety about? Sometimes it's just the general anxiety. But also specifically with the depression and anxiety and cannabis use is making sure that folks understand that it can actually lead to more. Because it changes the way that your brain connects with the naturally occurring chemicals and it wants to do those things that are easier. And cannabis and THC is a lot stronger than our natural stuff in our brain, so it can make it harder to deal with our anxiety and depression that way.
Right. Thank you. And Mary, I see your suggestion of talking about mindfulness practices, including meditation and breath work. Great. Yeah. If anyone else has any other suggestions, feel free to chat in there. Yeah. And Kelly, thanks for sharing your resources about cannabis and pregnancy having a higher incidence of hypertensive disorders. That is significant. Hypertension is such a problem right now in pregnancy. And Mary, I also saw your question, is more research being done now that we are moving toward regulation and legalization of cannabis? I was going to ask that same question. If you're familiar with any research that's currently happening or any new research, I know you shared some resources at the end of the presentation that we'll email out. If you send that to me, I can email that
Okay.
out. We also have some resources on our website, mainbreastfeeds.org, and I'm happy to update those. Anytime anyone sees anything that you feel like we could add to our resources, happy to do that. And I did just see that there was a research article, just need to get back to it now. Um, Again, sharing really more about um, how much THC might be found in milk and how long it's in milk, but we still need, as you mentioned, more research on the impacts on the infant. What I just put in there talks a bit about how long it stays in milk. But I will let you answer the question, Brianna, if you have more to share.
No, it's whenever we have more access and availability, we can get more research. There are not a ton of large scale studies that we have yet. If you want to do any studies, I always encourage that. Colorado does have a lot of information because they have been an adult use legalized state a little bit longer than we have, as is California. The Kaiser Permanente out of Northern California, I will share any information that I can from that. They had a really good presentation about cannabis use during pregnancy, and there have been some published articles with that, but it is something we need to explore more in that process of doing it. It takes some time.
Mhm. Exactly. Thank you, Brianna. Yeah, and Colorado often has some great resources since they've been
Yeah.
at this for a long time. Mary, I agree. The phrase listening to learn is so helpful in our day-to-day lives, professional lives, but also personal lives. Excellent. And thanks, Brianna, for sharing your email address and the resources and for being here today. And thank you all for being here. I really appreciate knowing that there are so many people who are interested in learning more on a regular basis. So thank you and have a wonderful rest of your day.
Thank you all.